Welcome to the Doctor Connect, a home for open conversation around cancer, health, wellness, and medical technology. I'm your host, Dr. Ludmila Schaefer, medical oncologist. We are so thrilled to have you with us today because our special guest is Dr. Dizon. He's a well-known physician, medical oncologist, breast cancer, and pelvic cancer specialist. And after that, we will take questions from the audience. Today, we do questions in cancers. So please submit your questions on the website, thedoctorconnect.org. And we will be right back. Dr. Dizon, welcome, welcome, welcome. Thank you for joining me today.
It's a pleasure. Thank you for having me.
Absolutely. Today we'll discuss some questions in cancers. And before we start our conversation and speak about some facts and myths, I want to tell that the breast cancer is really one of the most common cancers, except skin cancer. And in women, it's about 1 in 8 could get breast cancer, and in men, 1 in 1,000. Now, before we dive in and speak more about it and answer all your questions, I would like for you to tell us a little bit of your backstory.
Sure, I'm happy to do that. I was actually born in the South Pacific on the island of Guam, which is a U.S. territory. And I left home in 1987 and have been in the continental United States ever since, actually on the East Coast, where I went to medical school and residency, and I actually trained in cancer medicine at Sloan Kettering. I decided, to do academic medicine, so I never went back home to practice, but I made my way across New England and worked at some of the best institutions, and now I find myself in Providence, Rhode Island at the Lifespan Cancer Institute, where I'm a professor of medicine there. I am married, and I have 3 beautiful kids, 2 of which are girls, and so the topic is very important to me.
Yeah, thank you very much. And what actually made you to be interested in breast cancer and pelvic cancer? And also, can you tell a little bit us where we are standing, with mammograms and all this scan? What are the recommendations now?
Well, I think the first thing to know is that mammograms are really quite important for women as part of the way to reduce your risk of breast cancer. And mammograms really can help us find disease at its earliest point, where it's either pre-invasive, a term that's called in situ disease, but also hopefully at a point where the disease is localized and contained within the breast and we can be surgically excised. Now, mammograms are quite important. And the recommendations are constantly being reevaluated. But for right now, for the post-menopausal woman, getting a mammogram every other year seems to be appropriate, although I will be perfectly honest, I still have women, whether it's due to a strong family history or prior breast disease, are getting mammograms more frequently. I think the take-home message on frequency of mammography and workup is individualized and really requires a conversation between you and your doctor, because just like you just pointed out, Dr. Schaefer, finding something abnormal in the breast starts a process to make sure if it's cancer, we find it and diagnose it. And if it's not cancer, we get to that negative point. But it's a process, and it can be very anxiety provoking, and it can be very drawn out. And when women and men, like you just pointed out, oftentimes describe being just taken off of their feet and rushed down this tunnel, and they just want the tunnel to end and they want to see the sunlight again. If you don't have cancer, that sunlight, that end of the tunnel comes quicker. But if you have cancer, that tunnel can extend.
It's very important that you mentioned, because also I have a question. For example, a lot of patients, they think that if someone, a neighbor or friend or someone that they know, they got cancer, they actually have the same cancer. And I hear many times, well, but I know that person, and that's what that person gets. So is it the breast cancer is the same disease, or it's a completely different cancers?
Well, that's been one of the most remarkable breakthroughs as we understand cancer today, and it's pretty much relevant across cancers, but especially in breast cancer. It isn't the same, the cancer that your best friend had, or your mom, or the neighbor down the street. Chances are it wasn't the same cancer that you have. I often will tell my own patients dealing with a diagnosis that their story, their journey, or their treatment course with their own breast cancer is as individual as they are, because we know that, when all of the facts come down and we look at a pathologic, look under the microscope and see what kind of cancer it is, it's going to be at least one of four broad categories, not one behemoth that we call breast cancer. It could be a hormone positive breast cancer, meaning it was fed by estrogen. It could be a triple negative breast cancer, which means it was growing no matter what the hormones were. It could be something called a HER2 breast cancer, which means it had a pathway, it had a switch that was turned on, making it grow, or it could be a combination of hormone positive and HER2. They're just very different types of breast cancer, and we're learning even within these big groups, there can be distinctions between them as well.
Thank you very much. And I want to remind all audience, please submit your questions at thedoctorconnect.org. And this is very interesting because we also have a question from the audience. It came and someone asked, why my neighbor getting immunotherapy and I'm getting chemotherapy? And they don't have any side effect, and I have nausea, vomiting, and I'm losing my hair. Why it's like that?
Well, that goes into the different kinds of breast cancers that we are treating right now. First of all, just for the folks in your audience who don't have breast cancer or are really worried about it, there are no assumptions about how we're going to treat breast cancer. One person who has a hormone positive breast cancer, and we look at the content of genes within that cancer, we can tell today whether that is a worrisome cancer or not. And if it's not a worrisome cancer, then you won't receive chemotherapy. But for those folks who need chemicals to treat their cancer, we are learning that there are specific forms of it that we can give immunotherapy to. We can rev up someone's immune system, literally take the blinds off of someone's immune system so that immune cells can find and target and kill breast cancers within them. That strategy doesn't work for everybody. And for those people who have a high risk breast cancer or are living with disease that has come back, chemotherapy still is a mainstay option. It's not what everybody requires, but it is an option to treat particularly advanced disease or disease that has returned.
I'm glad you mentioned about men, because we also hear that men say, oh, no, breast cancer, it's not, it's only for women. Yeah. And, statistics show that it's about 1 in 1,000 men can get breast cancer. Is that correct?
Yeah, it's different. Breast cancer is definitely a cancer of the female gender, but it is important to note that it is not exclusively a diagnosis of women. Men do get breast cancer, and the unfortunate thing today is that breast cancer is stereotyped in pink and in femininity, and oftentimes men are on the very awkward point of not seeing themselves in a community with a disease that affects women predominantly. But having said that, men can get breast cancer. The treatments are the same, the pathways are the same. If it's hormone positive, we'll approach it that way. If it isn't, we'll approach it another way, just like we will in women. But incredibly important point for men, if you're noticing a difference between your chest, if you have a little bit of breast tissue on one side and not on the other, or if you feel a lump, that could be something to worry about. early presentation is important. Go see your doctor.
And when you mention about high risk, it reminds to me, for example, in my field among gastrointestinal cancers, in pancreatic cancer, we say sometimes to our patients, well, pancreatic cancer carry breast cancer genes.
Yeah.
And because now with all new molecular tests and how we find, we actually see also BRCA1 and BRCA2. Can you tell us a little bit in breast cancer, how person would know if actually at risk and should go and do genetic tests or not? How do I know if I carry breast cancer genes?
So these genes that we're talking about are genes that you inherited from your mother or your father that increases the risk of cancers. And in the context of BRCA1 and BRCA2, it's not only breast cancer, it's ovarian cancers, pancreatic cancer, prostate cancers in men. So these are important genetic, what's called genetic predisposition syndromes. Not that you get these genes, you will get cancer. If you have these genes, you're at a higher risk of getting cancer compared to people who don't have those genes. The ways we can tell who should be tested, if you were diagnosed with breast cancer, then we will refer you to a genetic counselor to see if you should be tested for BRCA1 and 2. So what do they look at? They look at your family history. Do you have a mother or a sister or a daughter who developed breast cancer? Do you know anybody, or is there anybody in your family who had two types of cancers, maybe a breast cancer on the left side and then a breast cancer on the right side? Is there a history of ovarian cancer in the family? Did your grandmother have it? What about a great aunt? So it's this very big exploration of one's family history. I think the important point to note, though, some of us don't have a large family, or some of us don't have a lot of women in our family, and some of us were adopted and don't know whether we are at increased risk. Those folks in particular, or I should say as well, should be referred for genetic counseling.
Yeah, that's actually very important because sometimes, we don't really know our family. And also, we think that, oh, maybe that's immediate first degree relatives. But no, we also speaking about second and third degree relatives and how important to know family history. So speak and learn about family history. Now,
yeah, Dr. Schaefer, I always think it's really important to remember that these BRCA genes don't pass on by the mothers only. The father's side is so important because you can inherit it from either parent.
Thank you. Very, very important point. Thank you. Now, I would like also we have some questions from the audience, but also, there are a lot of myth in breast cancer. And we don't speak that many myth for some reason in colon cancer and pancreatic cancer, but in breast cancer, it's just everywhere. So I want to kind of like play with you a little bit and see what's the fact and what's the myth. So I have a questions from the audience. Does milk, like dairy products, does milk link to breast cancer? Facts or myth?
That's going to be a myth. That's a myth. Sometimes it comes up with soy products, but even there, the products in the United States that contain soy have such a low volume, it doesn't increase the risk of breast cancer, even there.
And so next one, being stressed out, if someone really stressed out, does it increase risk of breast cancer? Fact or myth?
So that is also a myth. Stress in and of itself doesn't increase your risk of breast cancer. Where I worry about it is in the person who's diagnosed with breast cancer and how they're going to tolerate therapy.
Excellent. Now, another one, there is no evidence that sugar in the diet causes breast cancer. Fact or myth?
That one is true. There is no evidence that sugar in your diet. And in fact, I like to tell the people we treat, right? Cancers can create their own sugar stores. They can create their own food. So essentially, it doesn't matter what's in your diet as far as sugar intake goes. If cancer is going to feed, they're going to feed, and they can create their own sugar. I think it's always just, but it's just important because I want to say eat. I'm not going to say eat all the cake you want. I think you still need
Exactly.
to follow a heart healthy diet, and we need to watch weight, and all of that's still important for sure.
I'm glad you mentioned about healthy diet. So for breast cancer, what is the healthy diet? Right now there's so
Hmm.
many new trends on diet.
Hmm.
You go out there, we have all kind of complementary medicine, we have all kind of
Hmm.
alternative, we have all kind of ketone diet, this diet, that diet. And I want to just tell
Hmm.
that it's true. We also need sugar for our heart and for our brain. So if we deprive our heart and our brain, so how are we actually going to function? But right now there's so many different diets. What's
Hmm.
the healthy diet to prevent breast cancer?
That's an important question. What we know are things that can be modified, not to prevent, because it's very difficult to prevent one person's risk of breast cancer. But what we can do is reduce the risk that you might get breast cancer. So that's where things like reductions in alcohol intake, because we know that people who drink a lot, over 2 glasses of alcohol a day, for
Yeah, I was going
example.
to ask, what do you mean by a lot
Yeah.
of alcohol? Like if someone drinks, 1 glass of wine per month, is that considered a risk?
That is not considered a risk, I think, and I always look to our European colleagues who drink 1 glass of wine with dinner and have great heart outcomes, right? So again, it's hard to look at, what can I do just for my cancer, because we want to look at how do we stay healthy. So, limited alcohol intake, high fruits and vegetables is a good idea. Low red meat is also a good idea. But a bunch of these things are really about increasing overall health. And that's where exercise also comes in. Maintaining a healthy lifestyle not only will reduce your risk of breast cancer, but will also reduce your risk of having a chronic illness like heart disease, like diabetes.
Interesting. And the exercise right now, it's a whole theme. Every time you turn any TV channel, you turn around, everyone advice on, exercise, exercise. So how much actually we should
Hmm.
exercise, sort of stay healthy? And another, guidelines, we have a, specific sterness exercise. But for breast cancer, what
Yeah.
would be exactly, what should I do to prevent breast cancer?
Well, so, we're not talking about lifting weights, for example. We're not talking about, you know, um, things, overly stressful things. What we're talking about with exercise is maintaining, again, healthy lifestyle. Brisk walking is a really important thing to do. 20 to 30 minutes, 5 times a week should be sufficient to reduce one's risk of breast cancer. You know, um, I have seen, and this is I guess the caution I would answer this with. I have seen people who run marathons. I've seen Olympic athletes, people at the prime of their life who are healthy as you can possibly get, still get breast cancer. So again, what we're talking about is not prevention for any one of us, but it's about risk reducing to as low as it can go. It is impossible, short of removing both of your breasts, which no one would recommend unless you have this genetic predisposition to breast cancer. But short of doing that, it's impossible to prevent breast cancer. What we can do though is take something into control, and that's where reducing our risks come in. Yeah.
And for everyone, what would be three main tips or three strategies that we can do to prevent breast
Mhm.
cancer today?
Mhm. So I think my three tips for our folks here is: one, surveillance mammography, seeing your doc, getting regular imaging. Okay, that's really important. And again, it's about early detection. Maintaining a healthy lifestyle for sure, watching your diet, exercising regularly, or briskly walking regularly, really important. And then talking to your family, learning your family history, seeing if there's a history of that cancer, bringing that to your doctor, having that conversation about whether or not you should undergo genetic counseling or even testing.
Thank you. And for breast cancer, speaking all of this, so is it right now breast cancer actually increasing, decreasing? How are
Mhm.
we doing overall in the nation?
That's a complicated question. It looks like the rates maybe they're not dropping; they're sort of staying the same. But
And
one
why
of
do
the
you
big
think
things
they're
that
not dropping? I mean, we're doing so many new tests, we're doing so many new studies, we are so aware, and especially with
Mhm,
the
mhm.
digital technology. Why is that?
Well, I think it's a double-edged sword because as we're picking up cancers early, we're probably picking up many of them that would not have done anything had they been left alone. It's this whole notion of overdiagnosis and finding cancers that were never meant to kill you. The problem today is that we have no idea of how to know if cancer X is a good cancer that's going to behave itself and not travel to your bones or your liver or your lungs or not. So we are really treating all of these lesions we're finding in the breast. So I think that's part of the reason. When you find pre-invasive breast cancer, it still counts towards the stats of a breast cancer diagnosis.
Yeah, thank you. Thank you very much. So I would like to come back where we started and speak about, pelvic cancers. That's something that,
Mhm.
community not really paying attention and sometimes even shy to speak about it.
Yeah.
When someone, let's say, has something with the arm or leg, we go around, we talk about it. But when kind of comes to a pelvic type of disease, infection, cancer, it's a very sensitive topic. Can you educate us a little bit more about it?
Sure, sure. So, I think one of the things I oftentimes um, find our patients living with is guilt, right? Why didn't they know this was inside of them? It's a big source of distress for people who are diagnosed with, say, ovarian cancer or uterine cancer or even cervical cancer. But honestly, cervical cancer, much like breast cancer, it can be found very early. That's why we have pap smears. And hopefully we can, I just said we can't ever prevent. We can actually prevent cervical cancer with a vaccine, the HPV vaccine. But for people with ovarian cancer, oftentimes they're going to present with advanced disease when the disease has already left the ovary. That is just a fact, and it's no one's fault that happened. I think what's really important is for people to understand their bodies and what their bodies might be telling them. You know, a woman who's been thin on her all of her life, whose pants are all of a sudden not fitting, or that they're tight, or she has this discomfort around her waist, or she's getting bloated and it's persistent, lasting a month, going on 2 months. That is something that should be a red flag. And correct. And I think you're right, Dr. Schaefer. It's so difficult for women and their caregivers to talk about these organs because they're so private. And quite frankly, they're internal organs. They're not external organs. They're not there for everyone to see. They're not even there for a woman to look at to know that something is wrong. And so part of it is when you get diagnosed with cancer, it is never your fault. Never. And even if it's found late, it is still not your fault. When they meet with us, it's always about this is time zero. Let's move forward rather than finding the reason why this happened to you. A very good friend of mine always said, you know, the answer to the question, why did I get cancer, isn't to try to find or make up a reason. The answer is, why not? Why not you?
Mhm.
You know, and that is as honest as any of us can really get.
Yeah, excellent, excellent. Thank you very much. And Dr. Don Dizon, we really would like to see how we can have you back. And I would like to tell all audience, please submit your questions at thedoctorconnect.org and subscribe our YouTube channel, The Doctor Connect TV. And thank you so much for being with us on the show. Join and subscribe our channel, and we are so excited to have you on this journey with us. And thank you for watching and listening, and we will be back with you soon. The Doctor Connect Show. We have many amazing questions submitted from the audience. and I'm going to answer as many as possible. When it comes to your health, and especially a behemoth like a cancer, there are no bad or apologetic questions. All questions are so important and great, and it's time to answer a few of your questions. My neighbor just told me has pancreatic cancer. I am very sorry. I heard it's not common, but it's increasing now. I'm in shock and afraid. What symptoms should I watch for? Wow, this is a really good question. I am so glad you asked. There are so many great questions submitted from the audience. Cancer diagnosis is always scary. Any new change in the body, discuss with your doctor. But definitely, some cancers are growing and some of them less common. So discuss with your family if you have not only pancreatic cancer, but any other types of cancer. Every pancreatic tumor is different. And now, patients get treatment based on molecular tests. Now, what does it mean? There are new tests that show the signature on the cancer cells, and that's how we identify to treat new cancers. Up to 20% of people have family genes. But most important, cancer occurs spontaneously. Many patients ask me, how long do I have? And we care not only how long, but how well do you live and your wellness. How well are you living? Medicine is to treat, but wellness is to live well. And it is a separate science that we will discuss in our next episode. I'm very excited because in our future episode we have a special guest, and I don't want to give it away, but it's a person is very famous. If you put things off and never take action, instead of building more knowledge in the beginning, later it could be more financial, physical, and emotional distress. People reach out to me to put a video so they can learn at their own pace at the comfort of the home. And if you are interested in knowing more information or earlier or other options, then we would love to share with you and show you more steps. I hope this video was valuable, and I hope you can take some nuggets of wisdom and decide what's the best information for you and design your best personal roadmap. We are super excited to have you on this journey with us. Thank you for watching and listening, and we are looking forward to seeing you in the next one.